Good morning, everybody. Thanks, Hisham, and thanks, Dennis, for the invitation to be part of this. I'm just going to highlight a few points. Some of those points were already discussed. Briefly, I thought this is really some of the barriers that we need to address and discuss. And those will go in a bit shorter details about those. One of them is mentioned already, lack of funding for long-term studies. And here I need to emphasize and respectfully a bit disagree with Andre that pharma is here just to make money. I guess we need somebody strong enough with the mentality of Trump in the region here just to state that 10% or 15% of the income of big pharma need to be giving back to the community in terms of a clinical trial and engagement of a clinical trial. But that's probably a must. Then we have a problem with the regulatory approval processes, then a limited collaboration between researchers, clinicians, and industry stakeholders. And then we have to agree there is the high complexity of the disease that we take care of, which is the cancer as a disease. It's a heterogeneous disease across different communities and societies with lots of mutations. So these are probably some of the strategies that we can tackle, enhance the collaboration, and I mean collaboration between academic institutions. Very few of our academic institutions in the MENA region, they collaborate. This is an issue was touched by Naji briefly. Then we have also to collaborate with the pharma. We have to agree that they are the partner with us, with academia, and they have to give back to the academic centers and to the community. We have also to collaborate with the government agencies. Public and private partnership was touched a lot by Hisham, Dennis, and Naji, but this is to be emphasized. But one major problem that we did not touch yet is the data sharing and open science across us. How many of us have access to our neighbors' data? So I guess one of the major issues that we can tackle is to share data between the lots of academic institutions in the MENA region. So sharing preclinical and clinical data to speed up research progresses, open access to research database, and that's extremely important to go forward. Fast track regulatory approval, that can be tackled. Patient-centered research, which is integrating the patient feedback and real-world data into research. We must admit that conducting a clinical trial with the current setup in the region is not as easy, but at least we have tons of data that we can publish as a real-world data. We have different genetics, different kind of disease entities, different stages at the presentation, and not all patients have the same access to treatment. So publishing real-world data from this part of the region can be a big plus. So with this, I'll leave those conclusion to the discussion process, and thank you.